Hey everyone, today's video is on the Extralevator Abdominoperineal Excision, the so-called ELAPE procedure. As we know, traditional APER often led to higher positive circumferential resection margin, thus leading to a higher recurrence rate. ELAPE procedure was developed to achieve more cylindrical specimen by including the levator muscles, thus reducing the positive circumferential resection margin. In the video today, I'll particularly focus on when to stop the laparoscopic abdominal phase before attention is focused on the perineal phase. By stopping at the right point, we ensure that levator eventually is incorporated in the specimen by the perineal phase. Hope you'll enjoy the video. We begin the dissection in the usual fashion at the aortic bifurcation. The peritoneum is lifted up and divided with a scissors diathermy. This allows the CO2 to lift the peritoneum further, facilitating dissection. The IMA pedicle was visible and there were some congenital adhesions which were divided gently. It is our practice to take a high tie for the IMA when possible to facilitate retrieval of lymph nodes such as this, which would have been missed if a low tie was carried out. However, this means that the aorta has to be dissected to have a good view of the IMA coming off the aorta. Clips were applied close to the aorta at the IMA, which was divided. This was followed by dissection of the IMV. The next step is development of the total mesorectal plane, the TME plane or the holy plane of Bill healed. This is a nerve-preserving operation. Both the right and the left hypogastric nerves are being preserved. Here, the right hypogastric nerve is removed from the TME package for its preservation. We continue our dissection in a circular fashion, the next step being the opening of the peritoneal reflection. This will eventually lead to the plane between the rectum and the prostate. It's important to differentiate between the fascia proper of the rectum and the presacral fascia. The TME plane is the plane that lies between the two. This ensures an avascular dissection with preservation of the nerve bundles. At this stage, the dissection in the right planes will give the appearance of a bilobed lipoma. All efforts should be made not to breach the retrosacral or the Waldeye's fascia at this stage. This can lead to catastrophic bleeding because of entrance into the presacral veins. We continue with our circular dissection, taking the so-called lateral ligaments in the same plane following the TME loose areolar avascular plane. At this stage, the vas and the seminal vesicles will become visible. This is one of the cues to stop the dissection. Here we have decided to divide the Denonvalia fascia. As you are aware, there is a debate whether to proceed the dissection anterior or posterior to the Denonvalia's fascia. Moving the dissection to a plane posterior to the Denonvalia fascia can preserve the neurovascular bundles. As this tumor was posterior, we decided for the division of Dannon-Valley fascia, trying to preserve the neurovascular bundle. The vesicles are seen clearly. This diagram depicts the neurovascular bundle anterior to the Dannon-Valley fascia. A dissection kept posterior, as done in this operation, will preserve the neurovascular bundle. A further cue for stopping the laparoscopic phase of abdominal dissection is the appearance of the pelvic floor. Here, the pelvic floor is demonstrated on the right side of the patient. The appearance of seminal vesicles anteriorly and laterally, a dissection up to coccyx posteriorly, appearance of pelvic floor bilaterally are good cues for stopping the laparoscopic phase of the ELAPE procedure. After intracorporeal resection of the sigmoid colon, it is our practice to stitch a swab to the proximal part of the rectum to facilitate extraction of the specimen during the perineal phase of the procedure. For this patient, we also used a prophylactic biological mesh for prevention of parastomal hernias. The patient did very well after the procedure. Pathological examination showed the specimen to be cylindrical in nature.